a.m. is back.
Well, this next story getting a lot of attention this morning. Four-time major champ Naomi Osaka. She has withdrawn from the French Open. So she posted on social media yesterday saying she's taking time away from the court after she was fined and threatened harsher sanctions for skipping her mandatory participation in media obligations. Osaka announced last week she was not taking part in press conferences, saying she has battled depression and anxiety, and explained speaking to the media often makes her very nervous. So in a written statement, Osaka said she, quote, never wanted to be a distraction and that her withdrawal is the best thing for the tournament, the other players, and her well-being.
Well, athletes of every sport have posted messages on social media supporting Osaka. And this morning, of course, a look at some of the pressures.
Yeah, so Renee is live with this. Renee, this is obviously getting a lot of attention and raising a lot of questions about the mental health of a lot of these celebrities and athletes.
Yeah, hey, Renee.
Yeah, hey, good morning, Ty and Celeste. It's a really interesting opportunity, really, to talk about mental health, and that is what this story is kind of giving us the chance to do. And fortunately, we've got a Valley psychiatrist with us this morning. This is Dr. Andrea Raby. She is the Vice President of Psychiatry for Bayless Integrated Healthcare, and we're talking about this tennis star specifically. You heard about the story yesterday. Tell me a little bit about your thoughts towards what she's going through.
You know, I mean, I think this is an issue that has been going on for a long time. We just really now have started talking about it. It's a challenge that all athletes face, I believe, to some extent. You know, in July of 2020, Michael Phelps came out with a documentary that's called The Weight of Gold, and this addressed it, I think, for the first time. He talked about the mental health challenges of Olympic athletes, but really, if you think about it, it starts at the high school level, it starts at the collegiate level. And so with this news story breaking yesterday, it did not come as a real surprise to me. If I can just cite some statistics as well, because I really want to illustrate to everybody how serious this can be. And 18 to 25% of collegiate athletes really and truly experience some form of depression, whether it's a major depressive episode, mild to moderate depression, and also, shockingly, it is the fourth leading cause of death, suicide meaning, in collegiate athletes.
Wow.
So it's definitely something we have to address in our athletic population.
Doctor, you're talking about how it starts young. What are signs that we're looking for, and what do we do?
We have to look for changes in behavior. I mean, you have these athletes that typically have an overachieving type of personality, which can be good, right? But sometimes if there's not the balance, which is really a key word, balance, we have to look for changes, like I said, withdrawing from friends, having an increased level of anxiety. A certain level of anxiety in terms of performance can be normal and even helpful sometimes. But if that anxiety is becoming so intensely strong that they start to withdraw from practice, they don't want to perform at all, and again, they really start to suffer in grades or their social interactions, this is something we really have to pay attention to.
Well, and we're talking about athletes, too, that are, you know, they're making news headlines. So that's one place to start. But the rest of our population, especially our young people, are not immune from this situation. And how important is it to talk about mental health, especially after this last year?
Especially after this last year, exactly. Thank you. And it starts with communication and education. Those are two huge things as well, not just the balance, like I mentioned before. So coaches need to be fully aware of it. Parents, of course, need to be aware of it. And we have to open up those lines of communication so athletes feel comfortable coming and talking about this. One of the things that we've learned in our field is that many times we pay attention to athletes in regards to how well we can coach them physically, right? We talk about nutrition, we talk about getting plenty of rest, all of those things add to performance. But what we forget is the mental health aspects, the depression and anxiety. So just like we have a coach for the physicality of athletes, we really need to address the mental health.
I like what you're saying in terms of mental health coaching almost, and it seems like not only athletes need that right now, but pretty much anyone can utilize, you know, those kind of benefits.
Exactly, right. And I think that as soon as we can start really opening up about this, the better. And the better the communication and the better we're able to address these issues in the short term and long run.
Okay, give us a message, not just for athletes, but for parents of athletes. What do you want them to leave with?
Parents, I feel that we really need to address some of the issues with our athletes, not just when it comes to, you know, the anxiety, like I said, that can be normal, but really paying attention to their changes in behaviors, like I said. And it's okay if, you know, we don't win every game or we don't perform at our best. That's part of learning and part of growing. So just, again, the balance with that and communication overall.
Great. Dr. Andrea Raby, thank you so much
You're
for
very
your
welcome.
time.
Thank you for having me.
Yeah, and for your information. Celeste, Ty, we'll send it back to you.
I think it was really good information, Renee. Thank you.